Imagine this: a state suing a corporation for allegedly fueling one of the most devastating public health crises of our time. That's exactly what's happening in West Virginia, where the Attorney General has taken a bold stand against a company accused of profiting from the opioid epidemic. But here's where it gets controversial. The target isn't a pharmaceutical giant, but a pharmacy benefit manager, PBM, called Express Scripts, now operating under the name Evernorth Health. Let's dive in and explore the details of this legal battle and the role PBMs play in the opioid crisis. In a press release issued on a Monday, West Virginia's Attorney General, J.B. McCuskey, declared that while opioid manufacturers have faced consequences for their role in the crisis, it's high time to hold accountable those who profited from the shadows. McCuskey's office has filed a lawsuit against Express Scripts, accusing the PBM of contributing to the oversupply of opioids in the state. But what exactly are PBMs, and how did Express Scripts allegedly exacerbate the opioid epidemic? PBMs are essentially middlemen in the prescription drug supply chain. They manage prescription drug benefits for various entities, including health insurers, employers, and government programs. Think of them as the gatekeepers who decide which drugs are covered by insurance plans and how much patients pay for their medications. In the case of Express Scripts, the Attorney General's office alleges that the company played a significant role in the widespread oversupply of opioids in West Virginia. And this is the part most people miss. PBMs, like Express Scripts, have the power to influence prescribing patterns and monitor drug abuse, but they often prioritize profits over public health. According to the lawsuit filed in the U.S. District Court for the Northern District of West Virginia, Express Scripts is accused of several misconducts. The company allegedly incentivized opioid sales, disregarding clinical judgment, and weakened protocols designed to prevent overprescribing. Moreover, Express Scripts is said to have ignored clear signs of widespread opioid abuse and violated West Virginia and federal controlled substances laws by dispensing opioids through mail-order pharmacies. To put the scale of Express Scripts' influence into perspective, the company controlled drug access for over 100 million Americans and maintained contracts with approximately 65,000 retail pharmacies, covering more than 98% of all U.S. retail pharmacies. Now, let's pause and consider the implications of this lawsuit. If PBMs like Express Scripts are found to have contributed to the opioid crisis, it could shake up the entire prescription drug industry. But here's a thought-provoking question. Should PBMs be held to the same standards as pharmaceutical manufacturers when it comes to public health responsibilities? And how can we ensure that these middlemen prioritize patient safety over profits? We'd love to hear your thoughts in the comments. Do you agree that PBMs should face consequences for their role in the opioid epidemic? Or do you believe they're being unfairly targeted? Let the discussion begin.